Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, the Hidden Genetic Risk Factor. And trust me, it's juicier than your cousin's peach cobbler. What if I told you there's a genetic heart risk factor that affects 1 in 5 people, yet most doctors never test for it? I'm talking about the hidden assassin lurking in your bloodstream right now, and you probably have no idea it's there. Buckle up, folks, because we're about to dive into something that could literally save your life. Let me introduce you to the villain of today's story, lipoprotein little a, or as we medical folks call it, LP little a. Now I know what you're thinking. Doc, that sounds like alphabet soup. But stick with me here. Think of LP little a as cholesterol's evil twin brother. While regular cholesterol is like that annoying relative who shows up uninvited to dinner, LP little a is like that same relative, but he's sticky, aggressive, and he brings his whole crew to trash your arteries. Here's the kicker, and I can't make this stuff up. Unlike your regular cholesterol that you can control with diet and exercise, this bad boy is 90% determined by your genes. That's right, your DNA handed you this card before you even took your first breath. The normal range is under 30, but I've seen patients with levels that are 10 times higher. It's like showing up to a water gun fight with a rocket launcher. Now here's where it gets really interesting, and by interesting I mean potentially terrifying. Most standard cholesterol panels don't include this test. Yep, entirely true. Your doctor orders what they think is a comprehensive cholesterol check. You get your results back looking prettier than a Sunday morning, and meanwhile this hidden assassin is quietly setting up shop in your arteries like it owns the place. I've seen patients with cholesterol numbers so perfect they could frame them on the wall, but their LP little a levels were through the roof. And guess what? This sneaky little particle has been linked to heart attacks, strokes, and aortic valve disease. The medical community is just now catching up to how important this is. It's like we've been looking for the house keys under the streetlight while they were sitting on the kitchen counter the whole time. Let me tell you about Sarah. She's 42, runs marathons like most people binge Netflix shows, eats cleaner than a whistle, and had cholesterol numbers that would make a cardiologist weep with joy. Then one Tuesday morning, boom, heart attack, knocked everyone for a loop, including me. Later, we discovered her LP little a was 180, that's 6 times normal. Turns out her father died of a heart attack at 45, same genetic pattern, like a really unfortunate family heirloom nobody wants to inherit. Sarah's story isn't unique, folks. I see this pattern more often than I'd like to admit. If your family tree looks like a heart disease convention, maybe I should see you in the clinic. We need to talk. So what can you do about this genetic curveball life threw you? First step is simple but crucial. March into your doctor's office and ask for a lipoprotein little a blood test. Don't ask, demand. Be that squeaky wheel. If they look at you funny, tell them Dr. Tauth sent you. If your levels come back elevated, don't panic, but do pay attention. It means we need to be more aggressive about managing every other risk factor you've got. Think of it like this. If you've got one foot on a banana peel, you better make sure the other foot is on solid ground. The good news is that new medications are in development specifically targeting high LP little a. Science is catching up and the cavalry is coming, but until then, knowing your number gives you power. And here's something super important. If you test high, your family needs to know. This is genetic, remember? It's like a really unfunny joke that runs in families. Get your siblings, your kids, your parents tested. Knowledge is power when it comes to genetic heart risks. Your actionable takeaway for this week? Call your doctor and request that LP little a test. Don't wait until Monday. Don't put it on your to-do list next to organize the garage. Do it this week. This hidden risk factor has stayed hidden long enough. Remember, 1 in 5 people have elevated levels, but most don't know it. Don't be part of that statistic. Be the person who takes control of their genetic destiny. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.